In this episode of SPCAST, I'm going to be interviewing Dr. Blake Wu, owner-operator of the Sports Pod. And our focus and our topic today is going to be the deadlift. This will be a two-part episode. First part will be the medical side. So he'll go into all kinds of cool stuff.
And then the second part is the jazz part.
Jazz hands.
Jazz hands. It'll be a lot about the strength and conditioning and kind of the training side, a little bit of why you might have back pain, and also how you can help avoid that.
Yeah. And also, if you're new to deadlifting, a good way to start as far as like programming looks, reps, sets, and all that good stuff.
Yeah. I mean, this is a common thing that, of course, being a chiropractor, I wouldn't say that our number one thing is low backs. We do have some low backs.
On a knee and hip.
Yeah, we get a ton of just extremity pain stuff.
A lot of overuse.
Yeah. But low back is obviously my bread and butter. I can do it in my sleep. And it's something that we, in my profession, we see very commonly. I think that for the sports pod particularly, we head that problem a little bit differently than most chiropractors. Again, most chiropractors are just going to want to adjust the back pain away, which adjusting is ridiculous. It's not ridiculous. That was just a clickbait there. You could have just used that for clickbait.
Yeah. One tool of
it's just a tool that we can use to get you moving, which if you want to check out our other episode of what we talk about there, about adjusting and all that, that's the Can a neck adjustment kill me episode.
Yeah.
But we look at it a little bit differently, and this is particularly a very common problem amongst lifters, CrossFitters, people who work out on a regular basis. You're not going to die, but you are the issue of your back pain.
Yeah, unless you got rear-ended in a car.
Yeah.
Most of the time, there's not like a specific event outside of the workout.
I think we should be clear about this, which is this what we're talking about back pain. This is in context of you didn't have a traumatic accident,
right?
If you had a traumatic mechanism of injury, then there's a whole different reason for your back pain. But this is specifically like if you are a healthy human being and you've been working out, and then all of a sudden you get back pain. This is an episode to explain why you have that back pain and what are some of the things that you can do to help alleviate it.
Right. So I think the first topic that I think you should cover is just the whole premise of like loading tissue and the capacity of the tissue.
Yeah.
And what that looks like.
My favorite analogy about loading. So the reason why you have the most common reason that you have back pain is you have a capacity issue. So think of your muscle as a cup and your workload as water.
Yeah.
If you have a very small cup, but a lot of work, which is a lot of water, what is going to happen? Your water is going to overfill the cup and it's going to spill over, and that's when you're going to have injury. So every tissue has a breaking point, a threshold.
Yeah.
When you do a bicep curl, you could easily probably do 20 pounds, but when you add in a situation where you are doing 20 pounds for 100 reps, your muscle is going to fail, right?
Yeah.
Or the reverse, you add a dumbbell that's 100 pounds and you try to do a curl, you're not going to be able to do it because your tissue has a capacity to only do 35 max pounds, and you're way overloading it. So the first issue that most people have when they're lifting is they are doing things at a capacity. So when it's the analogy of too many reps, which is a volume issue, you might not feel the back pain immediately. This is that situation where you will feel the back pain maybe a couple hours later, a day later, 2 days later, or it'll slowly creep up on you.
Yeah.
But that's a volume thing, right? Your capacity does not match the workload that you were asking the low back to do.
Mhm.
And then that's when your shit really fucks up.
Yeah.
And then the other issue is you go for a max deadlift or you go for a max lift and you're not warmed up enough, or you haven't done the prerequisite work, or structurally your just body can't handle a 500-pound deadlift. But for some reason you had smelling salts that day, you had your Skittles, and you were like, fuck yeah, I'm gonna think about my ex, and boom, you do that 500-pound deadlift and your tissue breaks. And there's several ways that your tissue breaks. You can have a strain sprain. So a strain is like the muscle gets overstretched and there's micro trauma in it. And then a sprain, honestly, is just like ligamentous, which is like the attachment sites of the muscle. And then you could also just like fucking completely tear it, which often happens when you do like that max lift, where you just like rip the muscle. Those are the two most common reasons or mechanisms of which your back will essentially give out on you, is the strain.
Could you also explain to people, I think it's helpful to understand the difference of, with muscle tears, the difference of like a rupture at origin insertion or a muscle belly tear?
Yeah, I mean, a rupture, well, there's different types. First, in the strain world, it's basically in your muscle belly, and you have grade 1, 2, 3, and 4.
Right.
And the way that I'd like to explain it is, if you had a plastic Target bag, if you try to rip it slowly, you'll see some deformity in the plastic bag, but there's like really no holes. That's like really a strain 1, where there's like thinner plastic and you know that it's going to rip. And then the grade 2 is, okay, now you're starting to see like little tiny holes as you continue to stretch it. Grade 3 is like, now you're seeing real big holes.
Yeah.
And then grade 4 is when you are basically hanging on by very small threads of plastic in the Target bag. And then after grade 4 is a complete tear of the muscle. A rupture is your muscles are tacked onto your bones. So it goes from muscle to a muscle, ligament, and then ligament to bone. And there are several different types of rupture. There could be a rupture right in the ligament. There could be an avulsion, meaning like the tendon pulls the bone completely off. And then there is a rupture right at the musculotendinous region, which is where it's actually the weakest area, because muscle turns into tendon and then tendon turns into bone. And the biology and the physiology and the anatomy of the human tissue is there's no direct delineation, right? It's not like a hard border where it's like muscle and then boom, ligament. It's just this mixture of fibers where you get closer from muscle to tendon, and then there's a place where it's like 50%, and then there's a place where it may be 60% tendon, 40%, and then the gradual increase into tendon or ligament. And the most common of ruptures is, one, a complete tear of the muscle. That you're gonna most likely do that first. And then the second is you're gonna most likely completely sever the tendon. And then the third is the musculotendinous junction, and then the fourth is an avulsion. You really have to fuck shit up for an avulsion.
Yeah.
Like it's got to be
probably have something else going on from a bone density standpoint for.
Yeah, or it's a traumatic event. It's generally a traumatic event, or extreme overuse. Extreme overuse.
Yeah.
at the very edge. But those are the types of strains. And then obviously with the different types of grades and different types of avulsions, and avulsion, if most of the time, is a surgical solution.
There's no blood flow.
Yeah,
that area.
and you have to get that bone back on. So honestly, oftentimes they just screw it back in.
Yeah.
Sprains, very easy to fix, just going to be very uncomfortable.
Right. Very uncomfortable.
And then depending on, grade 4 sprain, it depends on how bad it is.
Right.
Sometimes it is a surgical intervention.
So that was helpful. I think so. We kind of gave you a little bit of insight as to the different types of injuries. Now, what I think would be helpful is to explain how we got there, meaning what went wrong for the back to have that, to take up that much of the work to get into that state.
Well, there are a couple of reasons for why. Let's just, I know that honestly, deadlift gets like a really bad rap.
Yeah, and a lot of orthopedic people will just say, "Oh, you shouldn't do deadlifts."
Yeah, or a lot of doctors. I would tell you that it's mostly medical GPs that will say this, which is like, well, just don't squat or just don't do a deadlift,
Right.
which is what a ridiculous notion.
Yeah, let's just throw the baby out with the bathwater instead of fixing the.
I mean, this is a hard statement, but if your medical doctor says, like, if your medical doctor tells you, or any doctor for this much, there are some chiropractors that say this and physical therapists, which are less likely to say this, but if they say the solution to your back issue is to stop squatting and to stop hinging or to stop deadlifting, walk out of that office. Because that's a ridiculous solution.
Yeah, these are primal, foundational movements.
Yeah, they're movement. I mean, I know that this is you being a CrossFitter, and some of our listeners might be CrossFitters at Goldman Sachs. Possible sponsor.
Send me an email for all.
I know that this is a very common mindset, which is, okay, so you're going to stop squatting. Okay, so then don't go to the bathroom. Don't ever sit down on a fucking low chair or a stool. Are you going to stop hinging? Don't pick anything up from the floor.
Grab her arm.
Yeah, like these are fundamental movements, and my whole thing is if you stop fucking using them, they're just going to get worse. So
yeah, and it's going to lead to other issues down the road.
Yeah, I get it. Goes back to the capacity issue. You stop using those movements, your capacity is going to be very low, and then you're going to do something dumb. You're going to do something completely innocuous, like tie your shoe or pick up your kid's toy off of the ground, and your back's going to go out. And you're going to be like, why? I stopped squatting and lunging, and it's because you fucking stopped training it. You have to train the range of motion that you have, or you lose it. And then you get injured. Those are the injured areas, is the places, the ranges of motion that you stop training. So any doctor that tells you the solution to your back pain is stop hinging or stop deadlifting, stop squatting, stop doing lower body, it's dumb.
Yeah. For those of you that, if you're watching and you've never heard of our clinic and what we do, we are very much believers in movement as medicine.
Yeah.
And if the movement is how you got there, the movement is also how you get out of there.
Yeah. And also, what is that doctor teaching you to be fucking soft? Like, the whole point is that your human body should be resilient.
Right.
Well, and you should be asking the question, why is your body so fragile?
Correct.
And I promise you, there's a fucking reason. There's a reason. You just need to find the type of person that is going to figure out what that reason is. So that being said, one of the biggest, outside of the capacity thing, one of the reasons that could be why you have this back pain is, well, why is your low back doing so much of the work? That's the first question. Is the kinetic chain in your body working the way that it needs to be? Do you have actual range of motion in your ankles, your knees, and your hips to be able to do the things that you should be doing?
Mm-hmm.
Your low back has maybe 4 or 5 muscles that get you into flexion and extension. Your whole lower body has like 50 muscles. So if you're lifting something from the ground, are you going to use the 6 muscles or the 50 muscles that are attached to the thing that are? So nothing is. This is this idea in sports rehab that there's what we call global movement and segmental movement. Global movement means what is the kinetic chain doing as a whole? So from head to toe, what movements or what parts of your body are moving to get your hand down to the floor to pick something up and then come back up? Okay, so that's the global movement. The segmental movement is, okay, what is your low back doing? Even down to the vertebra, what is each vertebra is doing? What is your hip doing? What is your knee doing? What is your ankle doing? Oftentimes, what happens is people do have normal lumbar flexion, but then they don't have very good hip hinging or hip flexion. So then that pushes the force back up either into the low back or back down into the knees.
Yep.
Most people have okay knee flexion extension. People have fucking terrible ankles.
Yeah. Yeah. And luckily the deadlift has a pretty low ankle requirement,
but not a squat.
Right.
So there is an Instagram guy, which, he has really brought this to light to just the normal layman's person, but this is something that therapists have known for a long time. When you were squatting, I fucking hate this, this one comment that I get every single I at least hear it once a day, which is, my trainer, my doctor, whatever, whoever, my fucking uncle, my gym teacher told me to never squat with my knees over my toes.
Good luck.
It cannot get out of the zeitgeist quick enough. Like it's been happening my entire career.
Heels, get back on your heels. Yeah.
Yes, no actual professional that knows what they're fucking doing would ever coach you to say, don't get your knees past your eyes.
Literally look up an Olympic weightlifter doing a clean.
Yes.
And just tell me if his knees are over his toes. They're like
way over his toes. And the reason why this is important, especially in a squat, is because when you don't use your ankles, or you don't have the prerequisite ankle dorsiflexion, which means that your toes are going up towards your knees. When you don't have that, what happens is when you get into a squat, you'll see this often, is like you're almost getting into a good morning position with like 500 pounds. Now you're creating a situation where your center of gravity is way past your toes,
right?
Which is not a good thing. And now in levers, in physics,
right,
your lever is now complete. All that load is going into your low back, which is what's causing you to have the capacity issue.
Yeah.
Which then breaks down your low back. And all you really needed to do is fucking fix your ankle dorsiflexion.
Yeah, because a squat should look like an accordion.
Right.
All those angles of your ankle, knee, and hip should be closing and opening at the same
time.
Yeah.
And your center of gravity should be in the middle.
Yeah.
It shouldn't be away from you. It shouldn't either in front of you or in the back of you. And for men, the center of gravity is generally their sternum. Women, it's a little bit lower down into their diaphragm. And if you feel like your center of gravity is over your toes or over your knees or behind you, if over your toes is most common, you're going to have back pain.
Yeah. The body is very adaptable. It's an amazing amazing organic machine. And so if your goal is to stay balanced, your body will find a way to stay balanced, which isn't always a good position.
Yeah. And so that is one of the biggest reasons is, okay, somebody's got to make sure that you have a professional to like look at how you are squatting and look at it in a global sense. So what does the whole system look like? And then start getting down into the individual parts of the system and seeing which part of the system is actually breaking down. That's how we get to the root of the problem. We're like, oftentimes with somebody with a low back pain, yes, I'm treating their symptom, but I'm also treating the fucking root cause, because the root cause is often coming from below or above.
Yeah.
Most likely below.
Yeah. So now let's talk about, you get injured. What happens next?
You're fucked.
The injury spiral, basically, like the what do you generally see happen in athletes after they've hurt their back?
Yeah, well, look, this is what I call you're layering shit on top of shit. And this, I hate to call out one group particularly, but
sorry, all because I could be, what does Leahy say in Trailer Park Boys? It's a shit
storm.
There's a shit storm coming.
Do you hear the shitnami? The shitnami is coming.
Sorry to get you off track. I guess all I can think of is Leahy.
Yeah. Shits of a feather. We should have a full episode of just Trailer Park Boy.
We should do a breakdown of an episode. Okay.
I call this the one particular group that is worse about this. Mm-hmm. And you know this very well.
Oh yeah.
Because you owned this group for quite some time. Is fucking CrossFitters. Yeah. CrossFitters are the worst at ignoring pain. And my general principle about pain is, one, it's your pain is a symptom or a signal from your body that's telling you it's your red engine light. There's something going on in your engine. You need to take care of it, or else bad things are going to happen. Yeah. And what a CrossFitter generally does is they will strain their back, or they'll strain their knee, or their hip, or whatever it may be. They'll be like, I'm just going to rest it, or I'm going to just like modify my workouts, or I'm just going to do things at half speed. And then they ignore it. So they're just ignoring it the entire time.
You haven't even gone over the most annoying thing people do, which is Band-Aid it. So it's like, I'm just going to put a belt on real tight. Yeah. They don't even know how to use a belt.
It's the worst. Or they'll Band-Aid it by be like, oh, I just need to put lifters on while I squat, which goes back to what I was basically saying is lifters put you into plantar flexion, and you're ignoring the root cause here. So they'll Band-Aid it or they'll ignore it. And then it kind of goes away. This never goes away. They're just like avoiding it. And then they do something inevitably like a Fran or Murph. Yeah. And you can't fake it in a long capacity type of aerobic.
You can't fake it in a long workout or a very super short intense.
Yeah. And so what ends up happening is they're now layering more injuries on top of injuries. And I put this out on CrossFit. It's also marathon runners. It's any fucking crazy type A athlete where they're just like, I need to train. Yeah. And you need to make sure. I mean, look, F1, Indy 500 cars, they have pit stops, right? Because they have to maintain and make sure that tires. Put fresh tires on, make sure that the oil is good, make sure that the alignment is good, make sure that the flaps are good. All this stuff. They're maintaining you would never put the car out for the 200 laps. You would never put the car out for F1 for 51 laps. It doesn't make any sense. You have to make adjustments along the way. So what happens is that you just layer one injury after another injury until it becomes catastrophic. Instead of if you had just seen a professional maybe once or twice, got it fixed, you go on your merry way. Now this one or two visits now has extrapolated to fucking 6 months of therapy, and it's because you just did. If you just had gotten it at the very beginning, it wouldn't have unraveled to
Right.
this crazy situation.
And when things unravel, you move away from tissue and you start dealing with disc.
Well, that's the general. Again, this is not a hard and fast rule, but what happens is it becomes very superficial, and then it becomes muscular, and then it becomes ligamentous, and then it goes to your fucking joint.
Right.
And for back pain specifically, once your tissues they fail, where does it go? It goes straight to your fucking disc. And now we have created a situation where it is way fucking worse.
For listeners that don't know the anatomy of the spine, and sometimes, you know, people throw words out like, oh, I ruptured a disc, I herniated a disc, I bulged a disc. Could you explain what each of those variations of disc injuries look like and what's actually happening in the anatomy?
Yeah, I'll start with the most mild, which is when we call it a discogenic joint, meaning once your tissues start to fail around your spine, the disc in between, which is you have your spine and it's a vertebra, it's a bone, and in between the bones, there's essentially a shock absorber in between it. And the most common analogy is a jelly-filled donut. So that jelly-filled donut has a gel in it that is absorbing force and is helping you move your spine from flexion, extension, rotation, all that stuff. Once your tissue starts to fail around the joint, it's going to go into the joint and your joint will get inflamed.
Right.
So it's getting stressed out and your joint is like, I don't fucking like this. And I'm going to start to inflame a little bit and you're going to start to feel back pain.
Mm-hmm.
You might feel a little bit of, so there's, once the tissue fails, your joint essentially takes over. And so in between the vertebra, which is the bone, there's a disc, and that's a shock absorber. That disc in itself will start to get inflamed. And that's when your first sign it's getting angry. Oftentimes there's not a lot of neurological symptoms. You're just feeling, this is that symptom of, I just feel general deep low back pain. It could be very focal. It could be like across your entire low back. That's because the tissues around your back are fucking angry, and now your disc is angry.
Mm-hmm.
The second thing that happens, most common, once you ignore that, that's the first ignoring.
Mm-hmm.
That's when you start to be like, I'm gonna put on my belt and I'm gonna put BioFreeze on that, and then I'm gonna start fucking. I'm gonna do my 1 rep max or my 85%.
Never done this before. I don't know what you're
for
talking
2.
Yeah.
And so then after that, that's when you start to get a bulge. The bulge is now you are deforming the disc or you're deforming the jelly donut. Nothing's coming out yet. You're just ballooning it out to the nerve. And this will often be correlated or associated with neurological pain. Now you are going to have pain from your low back, or you'll be like, my fucking hip is just feels so achy.
Mm-hmm.
And then it'll go down into your hamstring, and it'll go down into it might go down into your calf. And then the worst of the 3 is full on herniated disc, meaning the jelly in the middle of the donut is now pushed out and fully into the spinal cord space or into the nerve root, which now is creating very severe low back pain, very severe sciatic nerve issues down your leg, into your groin, into your thigh. And then in the most severe cases, you might have loss of motor control. So it's called drop foot, meaning your foot doesn't ankle dorsiflex or ankle plantar flex anymore. It just like flops over.
Right.
And that's because the pathway of the motor nerve that goes into your foot is being impinged or being distracted from the herniated disc,
Mhm.
which is creating the issue.
Right. So last, how do we prevent this? What do we do?
Don't be a clown.
Don't be. We've all been clowns before, but what are the main preventatives mobility wise for people to avoid?
I mean, if I had to tell people like what the low hanging fruit is, one, I would make sure that you are making sure that you are getting good hip extension. So working through your quads and getting mobility into what we call hip extension, which is smashing through your hip flexors and your quads and just doing that very consistently. Then the second thing is making sure that you have mobility of your ankles. So have the proper prerequisite ankle dorsiflexion,
Mhm.
ankle plantar flexion. Most people have the ankle plantar flexion, but they don't have the dorsiflexion. Then the third is make sure the posterior chain is fucking strong structurally and also muscularly. A lot of people focus on their quad monsters,
The anterior, the mirror muscles, the
the
ones you
mirror
see.
muscles, yeah. And then they wonder why when they do a pull or they do a squat, their back goes out. It's because their whole backside, which you'll talk a lot about,
Yeah.
is so weak. And then fourth is if you know what the greatest predictor of an injury is? A fucking previous injury.
Right.
So get it fixed. It's not that hard. There are people out there that are want to help you. You only have one fucking body. Imagine if I at fucking 16-year-old I said, "Look, I'll give you any car in the world,
But you get one.
but you only get one car." How well would you maintain that fucking car? Well, guess what? You only have one of these bodies.
Right.
Only one in this lifetime. So, are you going to maintain it well? Or are you going to fucking treat it like trash?
Right.
It's that adage of shit in, shit out. So if you are fucking giving your body shitty nutrients, you're not treating it well. Well, it's also going to output shit. So treat it well because you only have one of these things called your body.
Mm-hmm.
Maintain it. Make sure that once you have an issue, fucking get on top of it.
Yeah.
Fix it.
Don't wait till it's a catastrophic issue.
Yeah, I mean, one of the things, this is a sidetrack. Oftentimes, I can help prevent an ACL injury from ever even happening.
Correct.
Because I can tell at like an age 12 when I watch you move or watch your student athlete move.
We know all the predictors.
Yeah, I'm like, oh my God, this
is waiting.
You play soccer and you move like this. You're about to have a severe ACL. And for the most part, unfortunately, I have called it multiple times.
Yeah. Which we should definitely do an episode at some point of the biggest predictors from like the red flags that you should be aware of, like what it feels like and where that kind of puts you in the stages of eventual injury. Because there's a lot of things your body will start telling you along the way.
Yes.
And when you get to a certain point, like there are certain things that when people tell me, like, I have this feeling here, my brain is like, oh, you're at the end.
Yes.
Like,
this is not good.
This is not good. Yeah.
We're about to go to explode town on your knee.
Yeah.
Yeah. It's there are predictors. I would love if anybody is really interested, honestly, watch RG3's fucking combine. I called his ACL, multiple ACL injuries quite early just because I watched his combine. I was like, that's how you jump. That's how you run. Like, dude,
his ankles.
You're smoked.
So
you are smoked.
Yeah.
So yeah, the best predictor of a injury is a previous injury. So get the injury fixed, find out what the root cause is, and then go back to your normal activity. But don't do it. Don't ignore it. Just please don't ignore it.
And once you know the root cause, that's where I come in.
Yeah, exactly. And then that's where Eric comes in. But those are my main points on the medical side of it for low back pain. And my suggestion or recommendation is it's a lot easier for me to fix it when it's kind of
Yeah.
a 4 or 5 out of 10 versus when it's a fucking 9 out of 10 and you can't get out of bed. Now, no one can predict when you're going to be at a 9 out of 10, but you are living with back pain right now.
We see people, there's a walk. There's
Yeah.
a walk that people
Yeah.
have, and they walk into the clinic and you're like,
Yeah, I mean the clinic has these 2 big windows right at the front, but they're frosted. But I can see the shadow, and I can see the silhouette, and I've been doing this for so long that I can watch the silhouette, the way that the silhouette is moving. I'm like, this motherfucker's got a back issue.
yeah, it's very obvious.
Yeah, it's so obvious when they walk into the clinic. So please get it taken care of when it's, at a 4, 3, 2, 1 out of 10, so that we don't have to get down to the 8 out of 10. Because I promise you talk to anybody that has had an 8 or 9 out of 10 where they can't get out of bed, they would trade anything in the world.
It's very mentally taxing too. You see people get depressed.
But you know what is really interesting? It's like heart attacks. People will have a heart attack, they might almost die, and then the doctor will be like, we need to change your eating habits. And the studies show that like within 3 to 4 months, they'll hold on to it for 3. They'll be very compliant to the nutrition for 3 months, and then they'll go straight back to what they were doing patterning before. So I think behavior is like a super interesting perspective of this. And we share a patient that, remember, he came in, he could barely walk.
Mhm.
He travels a ton. He's like in New York and also in LA often. And I was like, you need to make time for it. And he was like fucking gung-ho. After I fixed him, he's like, I'm going to train with Eric and we're going to make sure that this never happens again. And he forgets that he literally has this every year happen almost on the dot.
Yeah.
He could barely fucking walk it. He could barely walk into the clinic. Barely.
Yeah.
And he was in a bad way for about 2 weeks, and then we got him out of it. And he was like, for 2-3 weeks, he was kind of compliant, and then we haven't seen him since.
Right. And we could probably put something on the calendar in 6 months, and I think we'd be pretty spot on.
Yeah, I feel like what is that day in baseball where I think the Mets have to pay that one player? Like,
yeah, because they had the way they structured the contract.
Yeah,
they're still paying him.
They're still paying him. What is that? Who is the athlete? For those of you who are listening, please comment who it's like Bobby Pizzuto Day or whatever.
Yeah,
and if they have to pay, the Mets have to pay. I don't know if it's the Mets or the Yankees or one of the big teams in the East. They have to pay him like $9 million a year, and it's just dead money. Mm-hmm. And it's just like every year, that it's just like this one patient. I know this one patient is gonna come back every fucking year at the same time.
And sometimes it takes 2 or 3 of those recurrences before they finally realize.
Yeah. When he comes back into the clinic, we should be like, it's Bobby Pizzuto Day.
Yeah. Well, we're gonna have to look that up. Someone comment.
Somebody comment on it. It's out there. Somebody knows.
Yeah.
Somebody knows. So those are the things that you need to do to make sure that your back is tip-top shape. Hopefully that helps.
Mm-hmm.
Tune in for the next episode of Eric's How to Train Your Way Out of It.
Yeah.